I thought I'd start with a little basic background about influenza viruses, just to sort of set the stage for why avian flu is a concern and why we worry about flu pandemics. Um, there are three types of influenza viruses, which are grouped as A, B, and C. But we almost never hear about influenza C. We get influenza A and B every winter when we have a flu epidemic. You're all probably very familiar with the winter flu. And this talk is going to primarily be about A viruses because this is a talk about avian and pandemic flu. And while B viruses are very important during the winter flu seasons, B viruses tend not to infect birds and they don't cause pandemics. So I'm pretty much only going to be talking about A viruses today. Now, this slide does seem kind of scientific, and I only put it in because people keep asking me, what do the numbers mean? You hear about H5s and H3s and Ns and numbers, and people say, well, what do those numbers mean? Well, the H and the N in the name of the flu virus refers to two proteins on the surface of the virus, hemagglutinin and neuraminidase. And these two proteins are very important in terms of the flu virus attaching to the host cell and creating an infection. And then once the cell has been infected and viruses have been replicated in the cell, they're important for release of virus out of the cell, which allows infection of other people. There are 16 types of hemagglutinins that are known, and they're basically just labeled 1 through 16. And the virus gets its H number from whatever of these 16 hemagglutinins it happens to have. And there are 9 neuraminases, and it basically works the same way. Very, very few of these hemagglutinins and neuraminases are found in human flu viruses. Currently, we have H1 and H3, and we have N1 and N2, and the combinations of those are H1N1 and H3N2, which are the A viruses that are currently in the flu vaccine and have been for many, many years. Even though there's a new flu vaccine that's slightly different every year, for the last probably 20 years or so, we've been doing H1N1 and H3N2 plus a B virus every year. Now, influenza A viruses, as I mentioned, B viruses only infect people. A viruses can infect many different types of species, and most of them are illustrated here on the slide. We've got people, of course, and you've heard about flu infections in birds, but horses, sea mammals, pigs, and many other animals can be infected by influenza A viruses. Now, moving on to the question of avian flu, I put this slide in. These are photographs that I got off the internet, and I want to point out that the harbinger of doom is not a statement; it's a question. And the picture on the right illustrates some of the fear that's surrounding this topic of avian flu, and the perception that people have of this being a very serious and deadly problem. So avian flu, pretty much as it sounds, is a flu infection of a bird. They are different strains from the ones that cause human infection. As I said, we have H1N1 and H3N2 right now in humans. Most of those other H and N numbers are animal and bird strains and tend not to infect humans. It's a natural type of infection. Bird infections with flu happen commonly. We usually don't hear about them. The reason that H5N1 is so much in the news is partly because of this question of high pathogenicity and low pathogenicity flu viruses, where some flu viruses are basically more serious than others. And these are what we call the high pathogenic flu viruses. So if you hear about highly pathogenic avian influenza H5N1, that's what they're talking about. And it basically means that the virus is very contagious among birds and has the potential for causing it. Not all highly pathogenic flu viruses can infect humans, but if they do infect humans, it has the potential for causing serious illness. It spreads among birds. Usually, wild birds carry it. They may or may not get sick. When the wild birds come into contact with domestic poultry, poultry tends to be a lot more susceptible to avian flu viruses than wild birds, especially H5N1. And where you get these explosive bird outbreaks, it's usually because the virus has entered a poultry flock. And it may be partly due to the fact that poultry are kept in closed environments and they have a lot of contact with each other. And if you sort of think about nursing homes where people have a lot of contact with each other in a closed environment and how we have flu outbreaks there, these outbreaks in poultry tend to be fairly similar. And avian flu, as I mentioned, very rarely infects humans. However, when it does infect humans, it can cause a variety of diseases. What we're seeing in H5N1 are generally typical flu symptoms, but it usually progresses to a fairly severe viral pneumonia. Some other avian flu viruses like H7N7 cause pretty much only conjunctivitis or what we know as pink eye. And depending on the virus, it can be life-threatening. So H5N1, since that's the virus that everyone's interested in, a little background. It was first identified in 1996 in a goose in China. And in 1997, there was an outbreak in Hong Kong where 18 people were confirmed with infection. 6 of them died. And the government of Hong Kong were very concerned about this and decided that the way to control this outbreak was to basically get rid of all of the chickens in Hong Kong, which was about 150 million chickens. And then the virus sort of went away, and we didn't hear about it for 5 or 6 years until February of 2003, when a family, a Hong Kong family, traveled to Fujian province in China. And while they were there, one of the family members became sick and died, and the rest of the family went back to Hong Kong. They didn't know what the first family member had died of, but the family went back to Hong Kong, and when they got back to Hong Kong, 2 more of the family members were ill, and these 2 were diagnosed with influenza H5N1. Now, if you think back to February of 2003 and put this in historical context, February of 2003 was exactly when another outbreak was identified, and at the time we didn't know what it was, but there were many people becoming ill, not in Fujian province, but in Guangdong province in China, and that was later identified as an outbreak of infection from the SARS coronavirus, which had never been heard of before. But at the time, if you put this in the context of not knowing what SARS was, and here you have a family infected with H5N1, the international infectious disease community was very afraid that this was actually the start of a flu pandemic. It turned out to be a SARS pandemic, which was you know, who can say which would have been worse? But the SARS pandemic was relatively easily controlled in a short period of time. And since then, you've all heard pretty much every day or every week or so another country is reporting cases of avian flu, either among humans or infections in birds. These maps illustrate the spread of avian flu, or H5N1, since 2003. The areas in red are areas reporting infection in poultry, and the areas in yellow reported only in wild birds. So this is since 2003, but if we look at the map that shows bird infections since January of 2006, you can actually see that there are fairly large areas where the virus is actually being controlled. So if you go back to, I'll go back to the first one. This is cumulative. So everything since 2003 and just 2006. So it does look like the area that's affected is shrinking somewhat. And then for human cases, the countries that have reported human cases are listed here. Not all of them are currently having infections. I'll show you a similar set of maps for people. As of June 20th, the World Health Organization had reported 228 cases and 130 deaths, which gives us a death rate of approximately 50%. But I do want to qualify this by saying that the cases that the World Health Organization is reporting up are generally people who are identified in hospitals. So it sounds like there's very serious deadly disease with 50% mortality rate. However, we don't really know that they aren't milder cases that we aren't recognizing and that aren't going to the hospitals and then are not getting counted. This may or may not be good news. On the one hand, it means that the death rate is lower. On the other hand, it means that a lot more people are infected that we don't know about. So it's sort of like, which is the worst scenario? And then these are the maps that show the distribution of human cases. This first map, similar to the bird maps, the first one shows human infections since 2003. And you can see human infections since January of 2006. So again, I'll flip back to the first one. You can see that the areas with human cases do tend to be shrinking a little. So we heard about avian flu spreading in birds, but how does it infect people, or even how does it infect other birds? Well, the flu virus, when it infects a bird, is similar to people when they get infected with flu. You know that they, coughing and sneezing, and everybody knows that mucus is contagious because it contains viruses. Well, it's pretty much the same thing in birds, except that their feces are also contagious. So you have these, the birds tend to get a virally respiratory infection similar to people, and then they also have feces that are contagious. And the human infection pretty much results from having contact with these infected birds or contact with surfaces that are contaminated with either their respiratory infections or more commonly with bird feces. And there's also evidence that you can become infected by eating raw poultry products. It has not spread from person to person generally. There has been a fair bit in the news recently, especially in the last few weeks, about case clusters. You've probably all heard about a family in Indonesia where I believe it was 7 family members became ill after having contact, or 6 family members became ill after having contact with one ill person. And there have been other reports of spread within families. There was a woman in Thailand who became infected after caring for her sick child. But these clusters all have one thing in common, in that these are people who have very, very close contact with a sick person. If you think of a woman taking care of a sick child, and if any of you have ever taken care of a child with a respiratory illness, and how much snot and coughing and sneezing and close contact there is, and you can see how very easy it is to get infected in that type of situation. Very importantly, it's not spread beyond one person. So you don't have a situation where somebody is sick, they infect somebody else, and that person infects one or more other people. It's always stopped at that first transmission step. And another very important thing, if you think about SARS and how many doctors and nurses and other healthcare workers, EMTs, who became sick taking care of people sick with SARS, this hasn't happened with H5N1, even though in most of the countries where people have been infected with H5N1, the healthcare workers tend to work without protective equipment. They may not have gloves and masks and the types of things that we have. And even in that type of scenario, no healthcare workers have been reported ill. So people always say, well, what happens when birds in this country become infected? It's pretty likely to happen, because if you look at migratory bird pathways, I mean, we get birds that come from Europe and Asia, and they fly to the US. So it's probably going to happen at some point that infected birds from Europe or Asia will fly to our country and infect the local birds. But what does that mean to people living in this country? Well, I've put up here, again, these are just pictures I pulled off the internet, but these pictures actually illustrate pretty well the types of interactions that people have with birds in places like Asia, Eastern Europe, parts of Africa, where people they live with birds. They work in live bird markets. They have a lot of very close contact with poultry that we don't have in this country. I mean, I can't remember the last time I touched a chicken, if ever, touched a live chicken. And we just don't, I mean, we don't have these types of exposure risks in this country. We're not living with poultry. Our children don't play in backyards that are contaminated with poultry feces. And we just don't have these types of exposures. So I'm not going to say that if birds become infected in this country, nobody's going to get sick. But the people who are really at risk are the ones who work with poultry workers, I know that the Lincoln Park Zoo is working very hard to make plans for if their bird populations become sick. But for the general population, I think the risk is actually fairly low. Now, just for comparison, because I do talk later about pandemic flu and the types of flu that spread from person to person, again, something we're familiar with every year from the flu season. How does flu spread from person to person? Generally by what we call respiratory droplets, which are what you've all seen, sort of like those freeze frame pictures of sneezing. You know, somebody sneezes, droplets come out and spread in the air. And we tend to call those respiratory droplets, and they tend not to, for flu viruses, the droplets that carry flu viruses tend not to travel over great distances. Usually, by the time they've gone 3 feet, they're kind of heavy and they settle out of the air. So this isn't something that we worry about, you know, somebody in one room coughing and sneezing and somebody in another room is going to get sick. There are diseases that'll spread like that, or somebody coughing in a room leaves the room, somebody else comes in. You know, by the time something like that happens, flu viruses tend to settle out of the air. Measles, on the other hand, would stay in the air long enough to infect the second person, or tuberculosis, but flu tends not to do that. So the best way really to prevent the spread of flu is what we call covering your cough. And this is a message that, you know, everybody's mother or grandmother or, you know, preschool teacher or whoever taught them when they were a little kid. If you're coughing, cover your mouth. And it's actually very good advice because it does stop things like flu from spreading. The other way that flu spreads is through hand contamination. So as I said, these virus particles tend to settle out on surfaces. Also, you know, if people are being diligent in covering their cough, but then they don't wash their hands, things that they touch can become contaminated. And then people who touch those, you know, either shaking somebody's hand, it always amuses me when people say, "Oh, don't kiss me. I've got a cold." And then they'll shake your hand. And if you think about how they've been coughing, you know, all over their hand, now they've touched your hand and your hand is contaminated. But of course we know that flu viruses don't go through skin. So it does take an extra step, and that step is rubbing your eyes, rubbing your nose, rubbing your mouth. So the way to prevent this is by washing your hands. If you think your hands are dirty, if you've touched something that you think might be contaminated, wash your hands. And that's really the other way. So covering your cough and washing your hands, something that everybody learned from their mom, is how spread of flu is prevented. Getting back to H5N1, another big question, is there a vaccine? Well, there is a vaccine. Or at least there is a vaccine under development that's being tested in research studies. It's not commercially available, and unfortunately, the vaccines that they've developed so far are not especially good. So the concern is that, yes, we might be producing vaccines, but will they actually work? And this is a big unknown. As I mentioned, there is an annual flu vaccine. It has H1 and H3 viruses, but it doesn't have H5N1, so it's not going to protect you, unfortunately, against this virus. And then there's the question of treatment. Flu viruses are treated with antiviral medications, which work sort of similarly to antibiotics. There are two different kinds, two sort of like broad categories of flu antivirals. There's an older group called amantadine and romantadine. They're two medications that are fairly similar. And there's a newer group, which are known as Tamiflu and Relenza. And H5N1 is actually predominantly resistant to amantadine and romantadine, which is unfortunate because these drugs are very cheap and pretty readily available. Tamiflu and Relenza are much more expensive and not as readily available, but it seems that they will probably work for treating H5N1, although there haven't been enough sick people and any studies done to actually test this, so it's not known for sure. And there is also some evidence that there may be Tamiflu resistance, which may be a problem, although it has been very rare. And what do you do if you're traveling to a place like Indonesia or China and you're worried about avian flu? Well, CDC hasn't recommended that people stop traveling. Traveling is fine as long as you take a few small precautions. It is recommended that people who are traveling get the regular flu vaccine if it's available. Now, I did say that the regular flu vaccine is not going to protect you against H5N1, and that's true, but it will protect you against regular flu, and all of these places do have regular flu viruses as well, and if you get sick in a country, well, at least it'll prevent flu infections, and if you do get sick, it'll help try to sort out diagnostically what you might have. Now, if you do travel to a place like Indonesia or Turkey or China, firstly, I'm a little jealous of you. Secondly, stay away from birds. That's pretty much the best advice, and it's not something that's so hard to follow. Just don't go to the poultry farms. Try not to go to any live food markets, or if you have to go to live food markets, don't touch the animals. Try not to touch any surfaces that are contaminated with bird feces. Again, not things that are difficult to follow. Wash your hands. If you're going to a place where you might be cooking, if you're touching raw poultry, wash your hands. You can eat the poultry and the eggs. There's absolutely nothing wrong with eating chicken and eggs, even in a place like Indonesia, as long as you cook it. And if you're cooking it, wash your hands. When you get back or while you're traveling, monitor your health. So basically, if you have a fever or if you develop a cough, see a doctor and tell the doctor that you've been traveling. It's really not a difficult message. Now, that's all I was going to say about the current avian flu situation. Are there any questions before I move on to pandemic flu and pandemic flu planning? It's not the same vaccine every year, but it has the same types of flu in it. So every year we have a vaccine that has an H1N1 virus, an H3N2 virus, and a B virus. But flu viruses change, and they change constantly by a mechanism that we call antigenic drift. And antigenic drift just means a slow mechanism of mutation. So that this year's H3N2 virus is going to be just slightly different from last year's H3N2 virus, but different enough that last year's vaccine won't protect you against this year's flu. Actually, now that I've said that, I don't know what's in this year's vaccines and whether or not they've changed it. They don't change them every year. It's kind of a confusing process making flu vaccines because every year during flu season, the international community collects viruses from all around the world and they analyze them, and then in about February or March, they look at all these viruses from the previous winter and try to predict what's going to be the predominant flu strain the following year. So it's kind of a tricky process, and they have to make this prediction early enough so that the flu vaccines can be produced in time for the winter, because flu vaccines are grown in eggs, and it's a very slow mechanism of production. So they need that sort of like 8 to 10 month period of time to make enough flu vaccines so that everyone can get vaccinated the following year. But because these viruses change, they do have to make a new vaccine every year. They usually change one to two of the strains in the vaccine. They don't change all three of them, but they usually change one or two of them every year.
How long does the H5N1 virus live outside of the body or the host? I know that varies depending on the type of virus.
Yeah, I don't know specifically about how long H5N1 lasts on surfaces. Regular flu viruses tend to last 24 to 48 hours on a hard surface, and probably about 8 to 12 hours on something like fabric. But I don't know specifically how long H5N1 lasts. I would expect it would be fairly similar.
Yeah, hi. I was wondering if you're aware of or you have an opinion about the hypothesis by some virologist. And in this country, there's a history professor named Mike Davis at the University of California at Irvine about how H5N1 became a highly pathogenic avian influenza virus. Are you familiar with that?
I haven't heard that theory. Have you?
Well, basically, it has to do with the way chickens are produced, like you mentioned in your talk. That basically, in a room this size, there would be anywhere from 25 to 30,000 chickens. And this methodology is not just used now in the United States. There's basically a wealthy Chinese family in Singapore that are billionaires that have worked with the Chinese government for the last 15 years to build these factories to compete with Tyson and Purdue. And this hypothesis is actually based on one Chinese virologist who said that the goose that you identified in 1996 came into contact with one of these factories in Guangdong, which is right next to Hong Kong. And I think the relevance here to the United States is the fact that this is the way most of our chickens produced. And these are supposed to be kind of biosecure facilities, and the fact is that in a lot of cases we don't know if they are or not because most of the regulations are voluntary.
Yeah, I don't know what they meant by how it became highly pathogenic. I think that some viruses are just more pathogenic than others. But in terms of how the virus spreads among poultry, I mean, we know from other infections like Salmonella and Campylobacter that housing chickens in close quarters where they're all essentially bathed in each other's feces does a lot towards spreading bacteria among birds and and viruses as well. So I think it definitely contributes to the spread of infection, but as to the actual pathogenicity, that's a property of the virus itself, and I would think that that occurred naturally. Okay, shall I carry on, or one more question?
I just wanted to know, so it's only the two strains of influenza that are around, or it's more than
Um,
that? Is it two or three?
well, there's H1N1, H3N2, and we usually have one or two B viruses circulating each year. So it's usually 3 to 4 strains that we see each year. And in the vaccine, we have the two A viruses and one B virus.
But when it comes to avian viruses, they have always been there, but they have never infected humans until recently,
No,
right?
that's not true. I mean, they have always been there. That part is true. But actually, I do have. I didn't put it into this talk, but there have been not as many as this, but there have been infections with avian flu viruses that have been recognized for many years, and we've only really had the technology for identifying viruses for probably the last 100 years or so. And the surveillance mechanisms, if people became sick, maybe nobody was looking for avian flu viruses. So I think part of the reason that we're seeing so much more about avian flu is that people are looking for it, and if you look for something, you'll find it. If you're not looking, who's to say if it's there or not? But there have been human infections with other avian flu viruses that have been documented going back probably about the last 20 years. But I think this would be classified as the largest outbreak. Okay, so I'm going to move on to the second half of my talk, which is pandemic influenza. Well, first of all, what is it? And how is it different from this avian flu situation? Well, basically, it's a worldwide outbreak of a new influenza virus. Although, as I mentioned before, we would actually have called the SARS situation a pandemic, so it can really be a worldwide outbreak of anything. There's an AIDS pandemic, as we heard about in the last talk. So really, it's a worldwide outbreak of anything. But in terms of pandemic flu, it's a worldwide outbreak of flu. And the fact that the calling it a pandemic relies on it being a new virus. So even though we see H3N2 virus around the world every year, we don't call it a pandemic because H3N2 is a fairly old virus. Pandemics occur infrequently and at irregular intervals. There were 3 pandemics in the 20th century, and I believe about 30 pandemics since the 1500s. So they're certainly not something new, but they don't happen very often. They are completely unpredictable. So if you ask me, is there going to be a pandemic of flu, I would have to say I don't know, because it's really not possible to say. And they have substantial impact, both in terms of illness and death, social disruption. If you think about, again, I keep going back to SARS because SARS is a very good recent illustration of a pandemic, and how much social impact there was in terms of people's interactions with each other, things like events being canceled, travel being stopped, the economic impact in the trade industry. There was a pretty big social and economic impact, and it was a relatively small event that only infected about a few hundred people. Now, as I mentioned, there were 3 pandemics in the 20th century. In 1918 and 1919, pretty much at the same time that World War I was happening, there was an outbreak of what was called at the time Spanish flu. And this was actually the first time that the virus H1N1 infected people. As you heard earlier, H1N1 is one of the viruses that circulates now every year, and that's what happens to pandemic flu viruses. They don't go away, they just become so common that they become the regular seasonal flu. The 1918-1919 pandemic caused 500,000 deaths in the United States and over 20 million deaths worldwide. And it's become the standard at which people talk about pandemics, and like how bad could it possibly be? Well, they say, it could be as bad as 1918, and that's how we tend to talk about, like the worst of the worst pandemics. In 1957 and 1958, there was another pandemic, which was called Asian flu, caused by the virus H2N2, and caused about 70,000 deaths in this country. And when H2N2 started infecting people, H1N1 actually went away. And for a period of time, from 1958 to 1968, the regular flu seasons, once the pandemic was over, the regular flu seasons were H2N2. And in 1968, H2N2 was replaced by H3N2, which is one of the viruses circulating now. And that was actually a relatively mild pandemic, which caused 34,000 deaths in this country. And if you want a comparison, every year in this country, we see about 36,000 deaths from influenza. Now, back in 1968, it probably would have been closer to 15 to 20,000 just because of the population dynamic. So it would have been lower then, but that's 34,000 is not any more than the annual influenza deaths that we have in this country. Now, just to complete the history, in 1977, I said that H1N1 went away in 1957. It came back in 1977, and everybody thought that there was going to be an H1N1 pandemic because there hadn't been H1N1 circulating for over 20 years. But it didn't. It didn't cause a pandemic, and nobody knows why. But now we do have H1N1 and H3N2. And I don't know if any of you were paying attention to the news back in about May of last year when there was this news story about flu samples that had been sent to hospital laboratories by the American College of Pathologists for the purpose of testing and training. And then there was this big furor, and all the flu vaccines, all the flu samples that were sent out had to be destroyed, and everybody was worrying about them. And the reason for that was that the virus that was sent out was actually H2N2, which was a human flu strain that we know could cause a pandemic, and to which anybody born after 1958 has absolutely no immunity. So it was actually quite a concerning event, which fortunately didn't have any serious ramifications. This is just a photograph from 1918, which illustrates the the impact that this infection had on many communities. So how does a pandemic happen? I mean, how is it different from what we see every year? Well, you need to have four things. You need a flu virus that's new. So basically a flu virus that nobody has any immunity to. Because even though this year's H3N2 is different from last year's H3N2, most people have some immunologic memory to H3N2, and even if you get infected, it'll probably be a relatively mild infection, and a lot of the population will have immunity. You know, even though a lot of people get infected, it's not that serious an event because of the memory of the other H3N2 viruses that you've seen in the past. So you need a new virus. The virus has to be capable of causing disease in humans. It's no sense trying to worry about bird viruses that have never caused disease in humans because most of them don't. You have to have a susceptible population. This goes back to the fact that it's a new virus and there's no immunologic memory. And the virus has to be transmissible from person to person. So the current flu situation, avian flu, H5N1, there is a new virus. It does cause disease in humans, as evidenced by the disease in humans. We are susceptible because none of us have any immunity to H5N1. But the key that's missing is this number 4, that the virus is not transmissible from person to person. And that's why we say, pretty emphatically, this is not a pandemic situation. It's a pandemic in birds, for sure. It's spreading very rampantly through the bird populations of Asia and Europe and now, unfortunately, Africa, but it is not a human pandemic. So where do new flu strains come from? Well, pretty much from animal strains, and usually it takes a mixing of a human strain and an animal strain to allow the virus to spread efficiently from human to human. And that's the problem with the H5N1 virus in terms of spreading. I mean, the problem from the virus's point of view is that it can't spread from person to person because it's still a pure bird virus. And the receptors that the virus has to attach to are not well adapted, and it's very difficult for that virus to infect people. So either mixing of a human or animal strain, or in some other way through mutation, an adaptation has to occur that allows that virus to attach efficiently to human cells. Now, in terms of pandemic planning, the World Health Organization has put together a chart. It's sort of like our color chart for bioterrorism, or the state of the nation's security. Well, this is the chart for avian or pandemic flu, at any rate. Phases 1 and 2 here. We've basically beyond that. Low risk of human cases, or actually interpandemic phases, basically there's no viruses, or there could be a new virus in animals with no human cases. Where we are is phase 3 here, where there is a virus, there is a new virus, and there are human cases, but there's no transmission from human to human. And even though there are those limited clusters, the World Health Organization has said that that is not enough transmission to raise it to the next level, which is evidence of increased human-to-human transmission. Now, SARS, I would probably put at stage 5, evidence of significant human-to-human transmission, but not evidence of widespread and sustained and efficient human-to-human transmission, which would be a true pandemic. So SARS pretty much ended at phase 5. Well, why do we care about a pandemic? There are actually many issues that concern us. One is that our society has become very global, and that people can travel around the world very rapidly on planes or various other conveyances, and we also trade a lot more than we did in 1918. I mean, if you think back in 1918. To get to across the Atlantic, you had to take a ship, and it took several weeks. You could do it now in a matter of hours. And again, I hate to keep going back to SARS, but there's ample evidence of how quickly viruses can spread around the globe through people becoming infected in one place and then traveling to another, where they then became sick and infected other people. There's a concern that our medical resources may be insufficient. You're all aware of how our hospitals are operating pretty much at capacity, and if you had to add in another, 10,000 or 20,000 or 100,000 infections that need to be treated on top of our already stressed medical system, we could run out of medical resources pretty quickly. Again, as we saw in SARS, medical personnel are pretty much at the highest risk for infection when you've got a virus that spreads easily from person to person. And unlike SARS, which we managed to control in a matter of months, regular flu is a lot more infectious, and there's the likelihood that the pandemic would last for, if not a year or two, and probably around a year or two, the pandemic would last. And then there's the potential for community and infrastructure disruption and economic impact. Now, people have done a fair bit of modeling trying to figure out how bad could a pandemic be. And one estimate that I usually refer to is the estimated impact of a medium level. So we're not talking about 1918 level pandemic, we're talking more like a 1958 level pandemic. It's estimated that about 35% of the population could be affected, which in this country would be around 47 million people becoming ill with the flu. Of those people, it's estimated that about 700,000 would require hospitalization and 200,000 would die. And the economic impact of such an event would range between 70 billion and 165 billion. Now, that's the doom and gloom. On the bright side, we are working very hard at the local level, which is where I work, state, national, international level, to prepare for a possible influenza pandemic. One of the things that has been dramatically increased in recent years is surveillance. And this is mostly done at the national and international level with CDC and the World Health Organization, but it also has roots in the local level because this is, usually if we're looking for flu infections, we look for them locally and then submit specimens to the national labs. SARS was pretty much a dress rehearsal for a flu pandemic. As bad as it was, and it was pretty bad, it did give us a very good idea of what we have to do to prepare for a flu pandemic and the types of activities that might have to be undertaken to control it. And it is important to remember that, even though we say 1918 was the standard for the absolute Armageddon of how bad could a pandemic be, in 1918 our medical systems and our isolation capacities were fairly primitive. We didn't know as much about hygiene as we know now, and there was also a war going on. So it is very hard to say, it could be as bad as 1918 when you take all of that into account. I mentioned the enhanced surveillance that's going on internationally for new flu viruses. And I just wanted to mention really briefly the new international health regulations, which the World Health Organization put together. That it basically took them the last 10 years to come up with these recommendations, and they're the first revision of the health regulations since 1969. And basically what it is a decision tree and a reporting mechanism for countries to notify the World Health Organization if there are cases of concern. And in some cases, like I don't think you're going to be able to read this, but in some cases, if in this box, a single case of certain diseases such as smallpox, polio, a new strain of influenza or SARS need to be reported immediately, even if there's only one case. Things that may be important and we don't know what they are, or some other diseases that may or may not be important, like cholera. Probably a single case of cholera is not that important. An outbreak of cholera is very important and would need to be reported. And then there's a sort of, for these two boxes, a little decision-making algorithm to follow to determine if you need to report to the World Health Organization. Now, the goals of pandemic flu planning, there are basically three of them. We want fewer people to become sick and fewer people to die. That's number one. We want to limit the amount that society is disrupted by the spread of the virus. That would be two. And we want to limit the economic loss. And, I know it sounds callous to talk about, dollars and the economy when people are sick, but this really could be quite devastating to the national economy, and that affects everybody. Planning has to engage all levels of the healthcare system, including public health and emergency response. We need to work with both the public sector and the private sector. And very importantly, we need to remember that a pandemic is not the only thing that we need to be prepared for. I think Hurricane Katrina was a perfect example of that, in that everybody's preparing for bioterrorism and smallpox, and all of a sudden there's a big hurricane, and the disaster came from an area that you weren't expecting. So it's very important to, whatever you're planning for, plan globally for multiple types of events. In terms of local planning, we are working on enhancing our disease surveillance, making recommendations for laboratory testing, making plans for antivirals. I'll talk a little bit more about antivirals in a few minutes, and vaccine distribution if there is a pandemic flu vaccine. Containment plans including isolation and quarantine. Now, this is something that we in America are not used to. The idea that you might be sick, or even not sick, you might be exposed to a sick person, and the government will take away your personal freedoms and make you stay at home or make you stay in a special facility. And that's something that we as Americans do not think, well, we haven't thought about much and don't like to think about. We don't like to think that the government has the ability to say, yes, we know you're not sick, but you were exposed to this person who is sick, and you have to stay here for the next 2 weeks. That's something that we're really not used to thinking about. Surge capacity, mortuary issues, and mass care. This is basically just, we need to make sure that we have more capacity to take care of sick people, and unfortunately more capacity to take care of dead people. We don't want to be in a situation of bodies piling up in streets, and it sounds kind of morbid, but it's something that we have to think about ahead of time. Making sure we have mechanisms of communicating accurate information to people. This would be both people in hospitals who need medical information, and to the public who need information on how this is affecting them and how they protect themselves. Now, the big questions then are, how are we going to treat this? How are we going to stop it from spreading? Well, we're very used to thinking about flu vaccines, and we rely on flu vaccines every year to minimize the impact of the annual flu epidemic. Now, as I said before, it takes many months to make flu vaccines. You need billions of fertilized eggs, and you need to grow the virus in the eggs and then do a whole lot of purification and processing. And it does take at least 6 months to create a good sized quantity of flu vaccines that would be useful to a large number of people. And of course, we don't know exactly what this virus is going to be. Again, it goes back to this issue of trying to predict what the flu strain is that we need to be preparing for. We do it every year for the strains that we know about every year. We still have to kind of do a bit of guesswork to figure out exactly which strain goes in the vaccine. And if we're trying to plan for a pandemic when we don't even know when the pandemic's going to happen and what strain it's going to be, it may be H5N1, it may not be H5N1, and if it is H5N1, well, there's at least 3 H5N1 circulating in Europe. Which one do you choose? So you could say, well, let's make all the H5N1 vaccines now, but we run a serious risk of that vaccine not working when a pandemic actually starts. So if we assume that we'll have to wait till the pandemic starts to design the vaccine and produce it, you have to give at least a 6 to 8 month lag time till we have the vaccines available. And when it does become available, we'll most certainly not have enough for everybody. And then we're going to have to make some very serious decisions about who gets that vaccine. Do we protect the people who are at most risk of dying? Do we protect the people who are at most risk of infection? Or do we just say it's a lottery, first come, first serve? And those are very, very important decisions that need to be made at high levels. And antiviral medications, as I mentioned before, the H5N1 is resistant to the cheap and plentiful medications. So we're kind of stuck with the more expensive and not readily available ones. And again, stockpiling is going on, but stockpiles are limited. They're certainly not enough for everybody, and we're going to have to make some very tough choices about who gets the antiviral medications. So having said that, what can we do to control a pandemic? Well, finding people who are sick and removing them from society, not removing from society, but removing them from a situation where they can infect other people is really going to have to be the number one priority. That people who are sick get evaluated, get tested, and get isolated. And then there's the people that they were with during the period that they were sick, so their families will have to be monitored for illness so that if they become sick, they too can be isolated. And this may bring up this component of quarantine in that, do we wait for them to become sick and then isolate them? Or do we remove them before they become sick and decrease the chance of further exposures? And then there's the basic infection control measures, going back to this covering your cough, washing your hands. That's so important and will be very, very important in a pandemic. And finally, there's a fairly new concept that did come into play during the SARS outbreak, and which will probably be very important in a pandemic, that we call social distancing. And this is something that people haven't really thought about, but if you think about what if you're on the subway and one person is sick? Well, might it not have been better to not be on the subway? And could we think about closing down public transportation to stop people from being sick? I mean, these are decisions that really need to be thought out and really a lot of thought go into these processes. Likewise, do we allow events like the Taste of Chicago, or every weekend in Chicago there's a festival? Do we allow that to go on when there's the possibility that people could be sick and infecting other people? Might it not be better to close all the special events? And the schools, because traditionally flu spreads very, very quickly in schools. Kids are little petri dishes when it comes to viruses. They cough, they sneeze, they spread viruses all over the place. And I believe many of you are educators, so you're probably aware of how rapidly a respiratory virus can spread in a school. Again, I'm not saying that these things will happen. They're just things that will have to be discussed at high levels, and some of these measures may be implemented in a pandemic. I think I've gone over most of this, but I'd just like to run through it again. Basic messages to prevent the spread of flu and other respiratory viruses. If you're not sick, how to protect yourself from being sick: wash your hands, stay away from people who are sick if you can help it, and get a flu vaccine if we're talking about regular flu season. For sick people, cover your cough is probably the most important one. Wash your hands, because when you cover your cough in your hands are contaminated. And very importantly, if you've got a friend or a family member who's in a hospital or in a long-term care facility, just don't visit them. And then there's this question of the workplace and the school environment. Staying out of places where you could infect other people is another very important thing. And then in terms of planning at the personal or corporate or school level. For workplaces, again, encouraging respiratory and hand hygiene, making sure that supplies are available so that there are sinks, that the sinks are stocked with soap and paper towels. Again, it's something very, very basic. You shouldn't even have to think about it, but ensuring that those things are in place is so important. If people are diagnosed with flu or if they're having severe respiratory illness with a fever, just leave them at home. You don't want these people. Nobody is that valuable an employee that they need to be at work infecting everybody else. Planning to function with high levels of absenteeism is something that every business or workplace should be thinking about, and creating mechanisms for employees to work from home if possible. And again, this is going to depend on the workplace. Obviously, the people in the retail industries can't work at home, but people in office buildings often can. Preparedness in schools. Again, your number one message has to be hygiene. The cover your cough, wash your hands. And I've put posters there because there are actually a variety of posters available free on the internet, or even designing your own. These two are a couple that are produced by CDC, and it basically just says precisely what I've been saying. Cover your mouth and nose when you cough and sneeze, wash your hands, and I don't know what else it says, but that's pretty much the basic message. Disease surveillance. If you're working in a school environment, you need to be aware of who is coming in and whether those people are sick. And creating mechanisms for systematic exclusion of sick students and staff is going to be very, very difficult. But again, it's something that's going to have to be addressed if we're in a pandemic situation and people are becoming infected. If we're either talking about closing the schools, or we have to make the schools a safer environment. And one way to do that is at the door, evaluating every person who comes in, whether they be a staff member or a student, and if they're sick, not letting them in. And this, again, is something that we're not used to doing. And then considering what might happen if the schools are closed. Again, I'm not saying they will be. I'm not even sure who makes the decision to close the schools. But if that decision is made, there need to be mechanisms in place for continuity of education. We can't just say we're going to close the school, recognizing that a pandemic could go on for weeks to months or even years, and just not educate the students. And then you have to have a mechanism for reopening them, and what you base that decision on as well. And then there's also this question of, even if we don't close the schools, are people going to stop sending their kids there? And that's what we refer to as self-shielding, that because there will be this surrounding fear that, if kids are getting infected in schools, well, I'm not going to send my child to school. And even if you don't close the schools, it may be done for you, essentially, by people keeping their kids home. And then personal and family emergency. This is not specifically limited to flu, but basically for any type of emergency scenario. I've kept it very, very brief. There are reams and reams of information on the internet on this type of thing, but every family should have a disaster kit, which should provide general supplies for emergencies for approximately 3 days. And the types of things that could be in it, food and water. If you're stocking cans, stock a can opener, have some cash on hand in case the ATMs are not operating, blankets, flashlights, batteries, a radio, that type of thing. It's your general disaster preparedness kit. A family emergency plan. If there's a disaster, where do we meet up? Having people's medical records available. If you have a family member with special needs or a pet, making special preparations for them, and knowing where to access accurate information. And then finally, there's a lot of discussion in certain circles about antivirals. And since they're a fairly scarce resource, should we all be stocking our own supplies, or should a company be stockpiling antivirals for their employees? And I would just like to say that it's a very, very bad idea. There are a number of reasons for this. One is that if everybody went out and bought a course of Tamiflu, there'd pretty much be nothing left for the hospitals and for the public health programs who need to use these medications to control outbreaks and to treat sick people. And since even though we're thinking about pandemics, we still have to think about regular flu season. And if there are no medications available during regular flu season where people really are sick, and you've got people at home hoarding medications for something that may or may not happen in the future, that doesn't seem right. If people have a stash of Tamiflu at home, how do they know when they're going to use it, or when it's appropriate to use it? If you get a fever and a cough, is that the time to take your Tamiflu? Do you take it if you hear that birds are infected in Canada or somewhere else in Illinois? And the overwhelming likelihood is that you'll take it and there'll be no risk, and you'll have wasted your $60 supply of Tamiflu. All drugs have the potential for the organism that they treat to become resistant, and Tamiflu is no exception. And the way that organisms become resistant to medication is through incorrect use. It's the haves versus the have-nots. People who can afford to go out and spend $60 on a medication to keep on a shelf will have it, and people who can't afford to do it won't. And that's a problem as well. And then there's this issue of shelf life. If you go out today and buy your course of Tamiflu, well, in 2 years it's going to be expired, if it even lasts that long. I mean, that would be the maximum. And as I said, the pandemic is something in the future we can't predict. I mean, we say a pandemic will happen because pandemics eventually happen, but if it's going to happen next year or in 20 years' time, nobody can say. And again, putting your resources into something with a shelf life is, for planning for the future, is not always a good idea. So that's all I wanted to say. These are some websites where you can get accurate information. The CDC's website, the World Health Organization's website, and the government's pandemic flu website. I've not seen anything that specifically relates pigeons as being at especially high risk for infection. I've not heard any countries describing outbreaks in pigeons. And we've generally seen infections in birds is in migratory waterfowl and domestic poultry. As I said, I've not heard of it being a problem in pigeons. But even so, I mean, even though the pigeons are out there, we don't touch them much, and you're still not looking at the concentration of feces and surface contamination that you would with like a backyard chicken flock.
My question is regarding for the incubation period.
Mm-hmm.
The incubation period is different for every kind of virus, or is it same for?
The incubation period is different for different types of virus, but for flu viruses, like for example measles, chickenpox, SARS, they all have different incubation periods, but flu tends to have an incubation period of 2 to 5 days. But there's some suggestion that it could be a little bit longer for H5N1, so I would say maybe 2 to 10 days to be on the maximum, but with most cases would be 2 to 5 days.
I just wonder what your thoughts are on who should prioritize, who should receive a potential vaccine or any social distancing policies. Do you think that should be federal government, municipal governments, or doctors and health organizations?
Right. Well, you actually asked two very different things. You asked about vaccine prioritization and you asked about social distancing. Social distancing is not something we prioritize. It's something that's imposed on a community. So if we decide to close special events, it'll be closing special events across a whole community. So that's not something that involves prioritization. Prioritization of vaccines and antivirals is something that we talk about a lot. And I think there are actually guidelines. There are federal guidelines which are available at the pandemicflu.gov in the HHS pandemic flu plan. But basically, the highest priority for vaccines are going to be healthcare workers. Doctors, nurses, not even all the healthcare workers, but the doctors and nurses and EMTs who are directly involved with taking care of flu patients, because they're at the highest risk for getting sick, number one, and because they're a very important resource for treating people who are sick and helping to control the disease. After the healthcare workers, there are, then you have to think like, well, who do you most need to stay healthy? And you might say that, well, your firemen are very important, or your police, and that's where it gets kind of gray. It's like, who's got a more important job than somebody else. And you also have to take into account who's at highest risk for getting sick, and who's at highest risk for dying. Now, we have priorities every year for who gets the flu vaccine, and even though every year there's generally enough vaccine for people who want it, there's not enough. They never make enough vaccine for everyone in the country, and vaccine gets thrown away every year. And then you get years like 2004 where there was enough vaccine to cover all the people who usually get the flu vaccine, but because there was a shortage, everyone's like, oh, we have to get it because there's not enough. And then there was a demand that exceeded the supply. But people who have immune system problems, people who have respiratory illnesses, people who have metabolic diseases like diabetes or heart disease, or there are certain types of medical conditions that if people get the flu, they're more likely to die, and those types of people would have to be elderly people, would be another one, very young children, and a lot of this is going to depend on the epidemiology of the epidemic, in that if we see that school-age children are dying more frequently than anybody else, we'll target to school-age children. So part of it's going to depend on what's actually happening, but there's two basic decision trees. It's like who's most important to keep your society functioning, and who's most likely to die of the flu. So that's the vaccine question. The antiviral question goes more along the lines of, do we treat the very sick people, or do we give medications to people to prevent them from getting sick? And it takes 10 pills to treat a sick person. A person who's not sick, who you decide to give pills to prevent them from getting sick, well, you have to give them a pill a day for as long as they're exposed, if that's the strategy you're taking. And if we're saying that this is going to be 6 or 8 or 12 weeks, or you can add up the number of pills, and it becomes astronomical if you try to go the prevention route. There's another way of preventing people. If you say that somebody was at a certain place, and like say a nurse was in the hospital, and a patient came in, and the nurse was exposed, and now is at high risk of becoming sick, well, you can give that person 10 days of pills to prevent them from getting sick. But that's what we call post-exposure prophylaxis, as opposed to just this, ongoing, we've got to protect you for the duration of the pandemic. I think for antivirals, it's going to have to be, sick people in hospitals get the drugs first. And there may be some plan to, if outbreaks are going on in facilities like nursing homes, we'll have to use drugs there to control those outbreaks. And then possibly, if we decide again, like we have to protect our healthcare workers, very limited numbers of people we may decide to treat them ahead of time. But those decisions haven't been made yet.